Hi everyone. Today we'll be talking about care plans here at the Mount Continuing Care Community. So, a few things to note about care plans as we start. By the end of the video, you will know where to find the care plans, how often to look at the care plans, what your role as the healthcare worker is in regards to the care plans, and the importance of person-centered care and family-centered care when developing the plan of care for the resident. So, first of all, what is a care plan? A care plan is a plan or a document that gives clear direction to staff on how to approach the residents' identified needs and their personal preferences. So, here at the Mount, it is important for you to regularly check care plans, which are located within the Cardex binders that are in the nurses' stations. So there's a Cardex binder for Hilltop, one for St. Dunstan's, and one for Carriage House, for example. And especially if you haven't worked on a particular neighborhood for a while, it is very important that you check to see has there been any updates or changes made to the resident's care plan that has happened because of a change in condition or a new health problem for the resident. So, some things you should include in a care plan are on the screen here, as you can see. So, there's a column for the date in which the assessment and diagnosis has been made. Um, so, the date would go here, of course, the assessment piece. This is where you would put in the nursing diagnosis and the main issue for the following interventions. So the example here, you see the assessment is about skin breakdown and the Braden score in relation to the skin breakdown risk. So of course, for intervention, depending on their Braden score, you would have a list of nursing interventions that would help achieve the goal here on the fourth column over here. So the goal would be to have no skin breakdown during a resident's stay here at the Mount. In the date reviewed column, so this should be done on a monthly basis at the minimum, or whenever the healthcare, or whenever the health conditions of the resident changes. So it is the role of the RN and the LPN to either edit the care plan document on the server at the nurse's station or to physically write down any changes and, of course, properly document and sign off here on the initial portion. However, for staff such as RCWs, it is your job to keep a keen eye on any changes and of the resident and update the supervisor as accordingly. So some other topics to include in the care plans, such as the follow risk assessment, dietary changes, mobility, activities of daily living, fall risk, general safety, diet and nutrition, mental, physical, and recreational activation or stimulation needs, social activities, the least restraint policy right here. How often should you be checking on them? Their toileting needs, religious or spiritual activities, whether, for example, if they're Catholic, Protestant, end of life wishes. Do they have any advanced care directives? Are they a do not resuscitate? And any special or unusual care requirements that are needed for this resident. All right. And as I mentioned before, it's important to include the resident when creating the plan of care, as well as the family as well. So if there are any specific preferences that We should respect about the resident as the healthcare workers, then that is important to note on the care plan. And essentially, this plan of care or a set of instructions and or directions as to how to provide the best personalized care possible for the resident that is in congruence with the principles of person-centered care and family-centered care. So thank you for watching. I'll see you next time. Bye.